The workup of the women is essentially the same as any other heterosexual couple. In other words, the women go through a series of endocrine studies to check thyroid, pituitary hormones, male hormones. We do ultrasounds to check their ovarian reserve, their egg supply. And following that, we make sure the uterus is normal, the tubes are normal, and we find out if they're ovulating properly by checking progesterone. So assuming that the woman's of a reasonable age in terms of her egg supply and that she has a good opportunity for pregnancy, this individual would be a good candidate to start doing inseminations. On the other hand, if it's a patient that's older, just like a heterosexual couple, will often drift towards IVF a little bit sooner. Both of those are reasonable options as long as we're not going too far with inseminations. For example, since we've had to use frozen sperm for many, many decades now, frozen sperm do not work as well as fresh sperm, and it takes longer to achieve a pregnancy. So I'll usually give a couple of guidelines of about 4 attempts before discussing IVF. Some couples also opt to do their so-called turkey-based inseminations at home, where they're doing just intracervical inseminations, which I don't encourage simply because under most circumstances it doesn't work very well. And the women tend not to undergo much of a workup. So you don't know if the tubes are okay, you don't know if her hormone levels are good or she's ovulating properly. So that's not to say that some women can't just order sperm from a sperm bank or use a known donor, but it's certainly not the ideal way to achieve a pregnancy.